some time ago, the director, Dr. Acton, issued an order postponing elective surgery. And the reason Dr. Acton did that was a concern about hospital space as we headed into this pandemic, and a concern of the surge. Thank heavens we have avoided that. We still have a concern about critical personal protection equipment. But she issued an order stopping elective surgeries. I can tell you that, from anecdotally at least, some of the stories that I've heard, that some of the procedures, some of the surgeries that we had no intention of stopping have been postponed. And frankly, that has concerned me a great deal. So we're starting back now. We're starting back one step at a time. And let me tell you, and Dr. Acton can explain it in more detail, exactly what we are doing. But we are beginning this long process of lifting the stay-at-home order and lifting the orders that we have. Well, I'll take a minute to talk about this order that Dr. Acton is issuing. As I said, on March 17th, Dr. Acton issued an order postponing elective surgery, and the goal was to preserve critical PPE and clear out necessary space in our hospitals. Because of your great work and our healthcare system coming together to share resources and work to meet community needs as a team, we have prevented the massive spike in cases that we feared. Now we must begin the gradual multi-phase process of reopening. My first concerns are the patients that have had procedures and surgeries delayed. They have been waiting, and it's time for them to catch up. It's important that their doctors and their hospitals now reach out to them, and we ask them to do that. So today I'm asking healthcare providers in hospitals and outpatient surgery centers to reassess those procedures and surgeries that were postponed, to talk with the patient, to take a look at it, to see whether now, the passage of time, this surgery is certainly something that needs to take place, or the procedure needs to take place. We're asking that they review any of the postponed procedures or surgeries with the patient in light of that patient's current health situation and quality of life, and make a joint decision about whether to proceed. In addition, for new or other chronic conditions that may have a significant impact on a patient's quality of life, providers and patients together may consider moving forward with diagnostic procedures. Patients must be informed of the risk, of course, of contracting COVID-19 and that impact during the post-operative recovery process. Patients must have the information necessary to make informed decisions and greater attention to the effectiveness, and pay greater attention to the effectiveness of non-surgical options. That must be made. Resuming surgeries and procedures I've described will take clinical judgment and will rely on our healthcare providers to make responsible decisions as we move forward, as well as responsible decisions being made, of course, by the patient. We're going to continue to work with hospital systems, healthcare providers, patients, and other stakeholders to determine the next steps. Eventually, we'll be reopening our doctors' offices and dentists' offices, and together we will get back to normal. But I thought today it was important to get started on that. So we again are starting on the way back with our hospitals and ask the doctors to reach out to those patients.